Can I have my student nurses come over, please? We have a patient that we need to assess. Her name is Zoe. We're just going to get her into the bed. Let's make sure we get her nice and comfortable. Hi Zoe.
Hi.
My name's Louise. I'm going to be your nurse today. These are my student nurses, Diana and Christina. You're going to help me assess you today. Is that okay for us to assess you?
As long as it gives me my pain meds.
Christina, we're gonna assess her head to toe. Where do we start off first?
We start off with the head.
That's correct. Diana, what is the first thing in the head to toe assessment we're going to assess? And can you start it, please?
We're going to assess level of consciousness. So can you tell me your name?
Zoe Henry,
Okay. And what is your date of birth?
10/10/1980,
Okay. And where are you at and what is the day?
Franklin Tech General Hospital, and it's Tuesday.
Great work, guys. Christina, can you pick up from where Diana left off, please?
Alright, I'm just gonna feel your head. Alright, there's a bump in the back. There's a lesion on the right side. Alright, can you take your mask off for me and smile? Alright, thank you.
Okay, Christina, continue on with the assessment. We're gonna check for her smile.
She just did the smile disease.
Okay. Diana, take over the assessment and talk me through it.
Okay. Okay. Now I'm going to check your eyes. First, I'm going to start with the eyebrows. Okay, good. She has a cut right lesion on the right eyebrow.
Me and the coffee table got into an argument at home when I fell to the floor.
Oh, goodness. Sounds scary. Okay. Can you close your eyes for me? Good. Go ahead and open them back. Looks clear. Okay, I'm going to take a flashlight and shine it in your eye and just check its pupils. Good. Good. Okay, now I'm going to have you follow the tip of the flashlight, okay? That's great.
Okay. Christina, can you check her nose and her ears and explain to me what you're doing, please?
Alright, I'm just gonna have you look up real fast so I can see if you have a dry nose. Alright, looks to see. Alright, just gonna check your ears, see if there's any cuts or bumps. There is none.
Christina, can you check her mouth, please?
Alright, say ah. Can you stick your tongue out for me? And say ah. Alright, her uvula goes up. Is that normal?
That's completely normal.
Alright, and can you go ahead and take your finger and go like this? Alright. Her teeth are all there and her mouth is nice and pink and moist.
Okay. Diana, jumping and continue with the assessment, working from her neck down.
Something we forgot is the nose. I'm
Okay.
gonna check it real quick. Thank you for breathe out on that side. Perfect. Okay, I'm gonna check your lymph nodes for any swelling. Good. Trachea is midline. I'm gonna check for carotid pulses. They're at a 2+. Okay, and then I'm also going to check the frontal. She is not dehydrated.
Okay, I'm gonna check her heart now. I'm gonna show you guys how to check the heart. Could I please use your stethoscope because I left my one at home? Okay. We're gonna check at the top. We're gonna let her breathe in and breathe
The
out.
lungs or the heart?
The lungs.
The lungs, okay.
I'm gonna get you to check the heart next.
Okay.
Okay. And then we're going to check her back to compare to her front. Okay. And you want her to inhale and exhale. Okay. You want to go ahead and listen to her heart?
I'm gonna check the topical pulse. Can I have you lift your breast for me? Thank you. She's at 78 beats a minute.
Thank you. Okay, Christina, do you want to take over from Diana?
Alright.
We're going to check mobility and strength of the upper extremities.
Okay. So I'm gonna have you stick out your arms and go in our circle. Alright. Can you flex for me? Alright. And then can you take your wrist and go in a circle? Alright, and then jazz hands. Perfect, perfect. Alright, and I'm gonna have you pull in. Alright, very strong. Alright,
Okay, do you want to palpate the radial pulses?
alright,
Both sides, please.
alright.
It's best if we do one at a time. Awesome. And what's her skin temperature compared to the rest of her body, on her arms compared to the body?
Equal.
Equal. Okay. Diana, can you please check the abdomen?
Okay. I'm gonna listen to your bowel sounds. Good. Everything sounds normal. There's no gurgling currently. I'm gonna palpate the stomach. Good. Can you lift your shirt for me so I can see if you have any lesions or if your stomach is.
Getting frisky now, huh?
It looks good. Everything looks fine.
Okay, would you like to check her lower extremities for edema and her
Yes.
pulses?
Yes. I'm gonna check. I don't see anything. Well, you do have a couple little bug bites there though. Okay, good. Check the pulse on the ankle. Perfect. And check the pulse on the feet. Good.
Okay, so I'm going to check her strength. Push back. Your stand up, please? Can you rotate your neck? Awesome. Can you do this? And can you do circles with your feet? Awesome. I'm gonna help you back into bed now, okay? Doing really good. Your gait and your balance is doing really good as well. Okay, so from 0 to 10, can you rate your pain? 0 being no pain at all and 10 being the absolute worst.
10.
Okay, so is the pain sharp or dull?
Very sharp.
Is it continuous or is it just coming in waves?
Continuous, especially when you talk.
Okay then, well, the doctor's going to be in shortly and thank you for letting us assess you. Do you have any questions?
When am I getting my pain meds?
That's something you'll have to talk to the doctor about.
Alright.
Okay, Zoe, thank you. Okay, ladies, we're going to hand over to the night shift nurses. So we're going to do what we call is a bedside report. Have you read up on how to give a bedside report?
Yeah.
I'm going to allow you guys to use your notes to explain what's happening with our patient Zoe. So when I hand over to you guys, can you introduce yourself to the nurses and you'll be explaining what you need to explain. So I'm going to start off explaining what the situation is. So this is our patient Zoe. She's 37 years old and she's a full code. Her blood pressure is 120/80. Her pulse is at 80. Her respirations are at 90. Her temperature is at 98.7 and her pulse oxygen is at 98%. I'm concerned about the bumps to her lateral right hand side of her head. So Diana, can you introduce yourself to the nurses and can you report on the background of her case? And like I said, you can use your notes that you've taken throughout the shift to help you.
Thank you. Yes, Zoe, she came to the hospital after falling and injuring her head in multiple places. The patient seems to be pretty alert and is oriented to where she's at, person, place, and time. She is cooperative but seems agitated. She's able to swallow but is lethargic, and her skin is warm to dry. Her lesions on her head, she has a lesion on her head, her eyebrow specifically, and she has a history of substance abuse and has no known allergies.
That was great, Diana. Christina, can you take over and you can use the notes? You are going to be given an assessment of Zoe.
Yeah. Zoe, she seems to be in pain. The doctor did give her pain medication, but she's due more within the next hour. She's on naproxen sodium, 500 milligrams, and as I mentioned, she is due to her next dosage, and this is by mouth. She's becoming more agitated as she says she's in pain and needs stronger pain meds. We have called for the doctor to come and assess her pain and see if they'd like to give her another form of pain medication or if they'd like to up her dose. Her pain doesn't seem to have gotten better or worse since being here.
Okay, thank you, Christina. That was really good. Now for the recommendations. I recommend to give her next dose on time unless the doctor states otherwise, and to keep monitoring her pain levels. You need to monitor her neurological functions and to check that she's orientated and alert every hour. I also recommend contacting radiology and seeing what the hold up is for her scans, as we've been waiting hours now. The family is due to visit at 2000 hours, and I would talk to the family, and I would also recommend taking her vital signs every 2 hours. So if anyone has any questions, now's the time, and if not, that will be the end of the bedside report.